You can penalize me if it's not. Okay, we are recording, and I'm going to share this screen. You should see common disorders of the cardiovascular system, yes?
Yeah, it's
All
there.
all right, so the first one we're starting with, most of y'all are going to be familiar with, is anemia. But what you might not know is there are several kinds of anemia. The most common kind is when we're lacking iron. And for ladies, that's not uncommon because heavy menstrual cycles or improper diet or something like that, that can lead to it. But basically, what is anemia? What would you write down if you didn't know the definition? Is it's the condition where your blood doesn't have enough healthy red blood cells. So if you wanted to summarize that, remember getting easy with the notes is blood downwards, the arrow decreased RBCs. So real easy, easy notes 101. Um, and if there's not enough RBCs, then that means there's not enough little uh, hemoglobin carriers, right? Because that's what carries our hemoglobin around. As the oxygen is vital, well, for all of our functions, and for not just um, thinking about the cardiovascular system, but for every other system in the body. And so we see anemia affect people with some different symptoms. And we're going to get to those. The three most common, like I said, is a decrease in healthy red blood cells, an increase in the destruction for some reason of those blood cells, and then deficiencies from from the blood in vitamins and into sometimes an absorption issue and other times from blood loss. Some anemias are inherited and some anemias are brought on by poor diet and toxins. The main thing you need to know though is anemia means you do not have enough healthy red blood cells. That means you're not carrying enough oxygen around. Iron deficiency, as I was telling you, that's the most common one we're going to see. And you don't have enough iron, and iron helps make red blood cells. Most people just need about 1 milligram, like just a tiny bit. Pregnant or menstruating women, they need a tiny bit more because they've got themselves and the baby. Okay? Now, what's a lot of people don't understand is that B12 is essential when we're thinking about hemoglobin production. And that's kind of getting way more advanced than what we need to worry about. But just know that there's a type of anemia that goes along with it. This is the one I have. And some people have a lot of trouble absorbing B12, like from their foods and different things. And so their body becomes anemic because the stomach's not absorbing what it needs. This is known as pernicious anemia. It's not that common, but it's not as common as what iron deficiency is. And we lump this into a vitamin deficiency anemia. And then there's something called hemolytic. Now, if you remember when we talked micro, I talked about how the blood cells, when they hit, bacteria, when we put them on a blood auger, that they would hemolyze. And remember, that means that they burst. Well, hemolytic anemia, or is a type of anemia that we know that causes the blood to hemolyze. Basically, it breaks down our healthy red blood cells, and this is really bad. Um, a lot of times this can range from, moderate complications to life-threatening severe. Sometimes we see this with lupus, but mostly we see this with toxins, like somebody who's exposed to large amounts of benzene, like working with chemicals, leads and coppers. Maybe push this up for your mama. But this is normally not a common one. Hemolytic anemia is usually very serious, and it's going to require infusions and different things like that. Now, the next one everybody might have heard of, but may not be too familiar with, is called sickle cell anemia. Now, this I want you to write, when you write sickle cell down, I want you to write that it is genetic, okay? Because it's genetic, that means it can be passed down. And this is also known as hemoglobin S, but most doctors and most everybody just calls it sickle cell. And what the problem is, instead of having a nice round red blood cell that has like a little, concaved part for oxygen to rest on, you have a red blood cell now that's shaped like a sickle. And a sickle basically is like the old-fashioned things, like the Grim Reaper carries for harvesting. They used them to harvest wheat. But your blood cells are shaped like that. And it's actually something that we see really common in the African American community. It has the highest percentage, even though it's still, they're not sure why, even though it's still very rare. When we do see it, and it's a lot of times it's little kids, and it's a painful thing, because you can imagine that we have normal round red blood cells, and if our blood cells aren't round and regular and flexible, and they're shaped like kind of like a jagged crescent moon, that could cause for some issues. And some of them issues can be blood flow problems. Some of them could be, I've heard of sickle cell patients complaining of pain. I had the saddest thing I ever saw was a little girl, and when she was having, I guess, I don't know if they have like flare-ups or times where it's worse, but she was going in for treatment at that time, and she was being picked up by EMS from going to one hospital to another hospital. And we transferred her, and she said, "Mama, my blood hurts." And how you imagine feeling your blood? It just broke my heart. Aplastic anemia it's deadly, and it's the absolute rarest, okay? And basically this happens when the body stops producing blood cells, right? Aplastic anemia is where you literally feel like you're dying. You don't have any energy. You don't have any type of, because you're lacking not only just red blood cells, all your blood cells, and the bone marrow. Obviously, the bone marrow would have to come in, because that's where we got our cells, right? And instead of the bone, for whatever reason, the bone marrow says, okay, I'm not producing these cells anymore. I'm going to start producing fat cells. And so what ends up happening is the patient becomes inundated with fat cells instead of the red blood cells that they need for survival and for life. This is usually something we see because of pesticides and chemicals. It was way more common before we had regulations and stuff over chemicals, pesticide stuff sprayed on crops. The treatment, most of the time, is going to be some type of blood transfusion and stem cell and bone marrow, that kind of thing. Really serious. Does anybody have any questions with any of those anemias before we move on?
Yes, I do.
Okay.
With the blood transfusion, it comes to a point that they can't continue on frequent basis, get blood transfusion because that affects them as well. It's a side effect.
Mm-hmm.
Is
Yeah,
that
no,
true?
yes, yeah. Some people, we had an instructor, she had, no, she had, I think she had what I had. She had the vitamin deficiency anemia and the pernicious, and she was getting transfusions because she was pregnant. And she eventually had to stop the transfusions later on in her pregnancy because her body wasn't still tolerating the excessive blood that they wanted to give her, but on the same hand, she was still really anemic, so they had to basically put her on bed rest, and it was a long kind of thing. But yeah, that can happen for some people. And if you don't, if the anemia is caused, say, due to some kind of trauma or some type of injury, which could happen, internal bleeding or something, then that would be the first thing they would do, is they would go and they'd think, okay, what's causing this low blood count? Okay, oh, well, she's got an injury or bleed or this and that. So they'd fix that, maybe give a transfusion and monitor it. And then usually after the patient heals, that goes back to a normal state.
Okay. And it said it's deadly, so it comes to a point that they just can't get any more.
This could be very deadly, aplastic anemia, absolutely, because uh, their their bones themselves and basically forget. And usually, one of the things that they use as a treatment for this, if the patient's a viable candidate, is
Mm,
bone marrow transplants.
okay.
So they go in there and they clean that, then they give them new marrow. Hopefully that
Mm,
will know, okay, let's make this right. Let's
hmm.
do this correctly.
Okay.
Uh-huh.
Got it.
Yeah. The next one I want to talk to you about is an aneurysm. Now, I did speak to y'all, but I want to pull up a picture in case you don't remember. Tell me, you can see my new tab?
Yes.
Okay. Oh, no, I can't spell. Okay. So we know we have vessels everywhere. Our blood vessels aren't just in the arm for drawing blood or down in the legs or by the heart. They go everywhere. We have the potential, even though those vessels are elastic, even though those vessels are designed to take pressure, designed to take, the pulsating rhythm of the heart flowing and blood flowing. We know that sometimes that they can balloon, sometimes they can weaken, and certain diseases, certain medications, certain uh, factors that we put into our life can cause this. And what an aneurysm is when a blood vessel either weakens to the point to where it begins to balloon and burst, and that's usually a life-threatening, critical, immediate, massive emergency. And that happens because of the built-up pressure. Now, sometimes if a person's lucky, um, they may their body might build like a little stem and where it's ballooning, but there's still blood flowing. But this is what we call like just a time bomb. It's kind of a matter of time. And this person's going to have some symptoms. But unfortunately, a lot of times people overlook those symptoms, especially when we're talking about ones in the brain, because they think, oh, I got a headache, or oh, this or that. And uh, a lot of times they overlook it until it becomes a life-threatening type of things. Um, we have, and this is showing a drastic big one, so you can see a picture. But sometimes we have really tiny ones, and the body's able to absorb that and heal itself. But for the most part, when we think of an aneurysm, we think of something that is going to either be congenital, meaning you were born with it, or it's acquired. And sometimes there's multiple factors that can lead to this. I'm going to let you know, here's the common causes of aneurysm from what I've seen back in the late 90s, early 2000s. There was a drug called fen-phen, and it was a diet weight loss drug approved by the FDA for weight loss, and it worked. But it also caused aneurysms. And I personally, my aunt died in her sleep from an aneurysm. She was taking fen-phen. My mother-in-law had a brain aneurysm, and she was in the hospital, barely lived from taking fen-phen. This is like no joke, guys. My sister-in-law was 8 months pregnant and had a splenic aneurysm. And she wasn't taking fen-phen at the time, but she had been taking it. And not only did she die, they were able to bring her back, but they lost her baby. And so, and then it put a famous name to it. If y'all remember the Olympian Jackie Joyner-Kersee, she also had been taking fen-phen to help watch her weight, even though she was a runner, and she had an aneurysm and died. So that drug was obviously pulled off the market, and there was some lawsuits. We have, and now we don't see that as an issue, but there are still medications out there that are known to increase your chances. But it's one of them, when we talk pharmacology, it's one of them risk because the benefit of the drug outweighs the chances. But let's talk about the more common things. The common things are cholesterol, because we know what does cholesterol go into our vessels and do. It makes them hard and less flexible and becomes rigid. So over time, that might weaken that vessel wall. Another thing is high blood pressure. If you imagine somebody whose blood pressure is always a little higher, always going a little more, and that person has that additional stress on the vessels, it could cause to a weakening. Now, another thing we know leads to aneurysms is birth control pills and cigarette smoking. Not those two combined are a real bad combo, especially for older women, because the two combined not only increase your chance of blood clots and stuff, but aneurysms as well. And I just had a really good friend of ours. His mother was 52 and still on birth control, and she was a heavy smoker. And she was sitting at the table and eating dinner, and then the next minute she was slumped over on the floor. She never recovered. And it's like, I'm serious when I tell you that. And a lot of times that's not something they mention to you about cigarette smoking. And,
Oh, wow. That's so
yeah,
sad.
it is. The whole family was just heartbroken. But they have, they, that's something that should be told to you if you are um, past, 40 and you're still on birth control and you are an avid cigarette smoker, then you should not be,
I have a
you,
comment. My daughter, she's going to turn 26, and that's a concern to me now because I didn't know it. I'm just
yeah,
being aware of it now, and she's on birth control and she smokes.
yeah, that's one of the things. You might get her information about it, let her know,
Yes.
because it does. And then if she's not thin, and if she's overweight, that only adds to it as well.
Yeah, she's been gaining weight as well.
Yeah, so
Mm-hmm.
those are
Wow.
all issues that can face that can cause that. Now, unfortunately, like I said, brain aneurysms, a lot of times they go unnoticed with no symptoms, but aneurysms can happen anywhere in the body. It is not just in the brain. I've heard of, actually, my aunt, her aneurysm was called a triple A. It was an ascending, meaning going down, aortic aneurysm. So, the really, really big, massive one, she had what's called a triple A, and she was immediately, it was gone. But she went in her sleep. And then, like I said, my sister-in-law's was a splenetic, so over the spleen. And then I've heard of people having them in the femoral. So an aneurysm can happen anywhere. Okay.
Mm.
Oh, another person. Do y'all remember Three's Company?
Yeah,
I loved that show.
me
Jack,
too.
the one that played Jack, he died of an aneurysm um, many years ago. But that's what killed him too, was an
I
aneurysm.
have a question. Can people also get colitis due to this aneurysm?
What could they get? What?
Col it's called colitis. I don't know. Maybe
Col-
I'm saying,
colitis,
uh-huh.
like the stomach related.
Yeah, with the intestine.
That I haven't heard of.
Okay.
Yeah, I know colitis can cause a lot of gastrointestinal problems, back pain, that kind of thing. But
Mm-hmm.
I haven't ever heard it associated with aneurysm. Doesn't mean it's not possible. I just haven't heard that. That's not.
Okay.
Yeah. Let me
Thank
get.
you.
Oh yeah, of course. And arrhythmias is the next thing we're going to talk about. And what did I tell you about the heart when we were talking about the heart? That the heart has beating, and when it's beating and it's normal, we call that what? Normal sinus rhythm, right? And that's what we want our patients to be in. We want them to be in we abbreviate that
A
NSR,
O
R, yeah,
R. Okay.
NSR, normal sinus rhythm. And that's what we want to see. And normally when we do patient notes, if we do an EKG or this or that, we'll put, NSR, normal sinus rhythm. One time. But with anything that's not a normal sinus rhythm, then it would be deemed an arrhythmia. Okay? An arrhythmia just means that it's not normal. And that means it could be anything from too slow to too fast to abnormal waves. And we're going to go back and we're going to talk about all of our waves again, okay? And refresh your memory. People uh, live every day with arrhythmias. Some people, they live with bradycardia, a too slow of a heartbeat, right? But for them, it's normal. Some people live with that little flutter, that one extra little boop, and that's called a PVC. And we'll learn about that. It's a premature ventricular contraction. And it basically feels like your heart just, it goes bum, 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 bum. And it's just like a little extra flutter, and you feel it. And is that life-threatening? No, as long as you're not having lots of them. So there are some that are life-threatening and bothersome, and then we're going to try to list and talk about the common ones, okay? The ones that you'll see on your EKGs of your patients, all right? Why do you not see my tachycardia? 1 second, let me try to correct this. That's odd. Oh, it was this one too. Sorry about that. Okay, so now we can see it. Tachycardia. We can have tachycardia, and it just is anything that's where your heart is beating over 100 beats per minute. Okay, so that's what you'd write down. The most common kind of tachycardia is ventricular, or VTAC. Okay, and that's what, when we think of tachycardia, that's what we normally associate it with, is the ventricles. All right, but in some case, there's others where it's the atria, but we don't normally call that a tach, we call that a flutter. And I'll explain the difference in a little bit. Tachycardia, some people might not even experience, their heart's 102, 103, something mild, okay? But it does put an extra, over time, load bear on the heart and the vessels. The symptoms of tachycardia, somebody who comes in, they might say dizziness, they feel short of breath, lightheaded. When you feel their pulse, it feels kind of rapid and bounding. And they may feel like they're having heart palpitations, that uneasy flip-flopping or fluttering in the chest. And then it also can cause chest pain. But what you need to make sure you write down is that it's a heart rate over 100, okay? And like I said, I apologize for that. I don't know why that's not. What are the causes for tachycardia? Common is high blood pressure. So who can tell me what the abbreviation for high blood pressure is? You should know this by now, guys. Anybody? Hypertension is HTN. So our abbreviation, HTN. Remember your abbreviations. Another causes is an enlarged heart, are cardiomyopathy, right? Sometimes heart valve diseases, and sometimes people can experience it before and after heart attacks. But coronary artery disease, CAD, is one of the major causes for it, and it's because of plaque and arterial sclerosis. It's a buildup that ends up happening to the vessels, and it's causing the heart to work faster and harder. And here's a perfect example. And I want everybody to look at this and take a second. So, what's the first thing you see when you see this? You see lots of points, right? Really quick. So we count them. We got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So what would their heart rate be? 120, right? So 120 beats per minute. Now what's the next thing you can look at that and tell me? What are these usually supposed to look like? Tight, right? That QRS should be nice and tight, but it's not. It's wide. So that's the second clue that tells me this is ventricular tachycardia, because when this QRS is wide, it's coming from the ventricles. And so, and then those are the two classic signs of ventricular tachycardia. A lot of extra complexes and real wide QRSs. And then you notice in some of them, it looks like the P's kind of missing, right? Because it just, the waves are coming fast, and the P and the S wave and the Q wave, I mean, not Q, the T wave, kind of just get lost because of how it's getting jam-packed all in there. The treatments, then this is something that is going to be dependent on the doctor that you work for. For me, when I worked as a paramedic, the most common thing that we try to do is have the patient do what's called a vagal maneuver. And the vagus nerve runs from the face all the way down. And we would have the patient, basically, you can stimulate your vagus nerve naturally. And how you can do that is by bearing down, squatting, and bearing down like you have to poop. When you bear down real hard like that, it slows the heart rate. And that actually is an issue for old people, especially old people who are constipated. And I think I mentioned this in the EMS community, we called those commode codes, because a lot of times grandma or grandpa would be constipated, have backed up bowels, and because of age, slowing, digestive issues, pain meds can slow down the bowels, and they'd get constipated. So they'd sit on the toilet, try and push down too hard, and end up syncope, fainting, and having heart issues or hitting their head. And a famous person died on the toilet, and that was Elvis. And they think that's exactly what he had done. He was constipated from way too many drugs and pushed down too hard, vagal maneuvered, fell off, smacked his head, and that was it. So now I don't want to every time I tell everybody that, they're always like, oh my God, I'm never bearing down to poop again. It's more than just that. There's factors around it. It's age, and it's severe constipation, that kind of things. But how about this? Have you ever gone and jumped into an icy cold lake or pool or something like that, and that first thing that happens is you go, right? That's your vagus nerve. That's a stimulation of the vagus nerve. So we see our vagus nerve respond to things a lot. We don't realize that that's what's doing it. Another common thing that we would do as paramedics is, and this was kind of way old school, is before my time, they'd get bowls of icy water and have the people put their face into it to try to stimulate the vagus nerve. I never did that. We always tried the bearing down to make yourself poop one. And then if that didn't work, there was drugs. We had adenosine was one of the common ones. And then if worst case scenario, if we didn't get the patient's heart rate down with vagal maneuvers or the medication, we do have to do something called cardioversion. And that's where we deliver a shock to the patient, and they were awake, but basically it was a real mild shock with the defibrillator. And it was to kind of tell, smack the heart around, get back in line, but it was painful, okay? And so that was not something I ever looked forward to doing on a patient. But when their heart rate's 190 beats a minute, and you've tried the medication and you've tried everything else, we've got to do something. All right, next, arrhythmia. is bradycardia. So it's like the opposite of tachycardia. So bradycardia, this is what you need to write down and make sure that you know, is going to be a heart rate under 60 beats per minute. Now, like I said, a lot of people, this is their normal. They're sitting on the couch, relaxing, their heartbeat's 58, 60. That's okay. Because as long as they're not having symptomatic symptoms from it. And what are those symptoms? Most likely, somebody's got to mute their mic. Most likely, it's they fear, they feel dizzy. They feel lightheaded. When they stand up, they see kind of stars. These are episodes of dizziness. They might even faint. And this is a word I want you to write down. You need to be familiar with it. It's actually pronounced syncope, and it means to faint. Okay? So dizziness and lightheadedness are the most common ones, especially with standing. They might feel fatigue, short of breath, confusion, or just get real tired easily. And it's because the heart's beating too slow to push enough red blood cells and oxygen around. So bradycardia can be an issue. Now, sometimes bradycardia just happens because of people getting older. As you age, your heart muscles and everything start to become less effective, and especially if you've led a lifestyle where you weren't active, or you did smoke, or you did do drugs or something like that, it can damage the heart tissue, can cause it. A lifetime of hypertension can cause it. Congenital heart defects, myocarditis, that's the inflammation of the muscle lining of the heart, right? Surgery issues. But another really common one that I want you to be aware of is, especially see this in older women, hypothyroidism. When their thyroid levels are too low, one of the side effects is bradycardia. Okay, and there's a bunch more that we could go through, and you can take a look at this. But basically, what we need to know is that bradycardia is beats 60 or less, and it usually makes them feel lightheaded, dizzy, and they could possibly have a syncope, which is fainting. Okay, we never want a patient to faint, because what do they risk hitting? Their head. So here's a perfect rhythm of bradycardia. When you look at that, it tells you something's not right. How many complexes we got here? 1, 2, 3, 4. So what's that person's heart rate? 40, right? Is 40 beats per minute good? No, that's not what we want. And you know what else we see here is this really long space. That's because that's where another QRS complex, or a PQRST, should be. A whole full complex should be here, right? In between those. And but the heart is under 60 beats per minute, so it's lower, so it's going to have that additional length in the EKG paper. You'll see it spread out. Now, and that right there tells you that's a period of time where the heart is not doing its oxygen delivering duties. And that's why you could see this person might feel lightheaded or see stars or not feel so good if their heart rate was that low. Now treatment is a little easier. Sometimes they're given medication, and those medications do a wonderful job. They stay on the especially the old people. They stay on the medication, it resolves the bradycardia. Other people have to have pacemakers placed into the body, and we're going to talk about those in a little bit. And a pacemaker basically monitors your heart rate, and anytime your heart gets a little too slow, gives it a tiny little electric stimulus to help speed it up again. Okay. And I'm going to do one more. Arterial sclerosis. And we're kind of familiar with this because I've spoke about this. And you know, I love pictures. So here's a nice healthy vessel. And you see the little red blood cells. It looks like little white cells running around, and they're like, hey, we're healthy, we're doing good. With arterial sclerosis over time, fat and plaque can build up and start invading the walls of the artery. And instead of us moving and flowing free blood and having nice elastic arteries, we start having a block up, congestion on the freeway, and those vessels aren't being as flexible as they should. And what that can lead to is blood clots or blockage, thrombus, all kinds of issues and bad things we don't want, right? So also the aneurysms could develop. So we don't want this. We want our patient's blood moving freely. How do we do that? By preventing our arterial sclerosis. And the ways that we can do this usually is prevent these causes. We're going to keep our blood pressure in check. We're going to watch our cholesterol, get it checked every year. We're going to, if we smoke, we're going to stop smoking. If you're diabetic, you're going to really watch your diabetes, and you make sure you control your numbers. And obesity, like I said, obesity is a big issue. Obesity leads to a lot of medical complications. And then there's causes a lot of times that we can't necessarily control. Some types of arthritis and lupus can cause inflammation that causes that. So those would have to be treated with medicine, but it's not something that the patients brought on upon themselves. Now the treatment, see, there's some good things about arterial sclerosis, and one of them is a lot of times we can reverse that by losing weight, stop smoking, start exercising with your doctor's advice. Get that cholesterol level back down to a normal level. And the ways that we do that is through diet, through nutrition, right? Stop eating the fatty foods and lots of red meat consumption and anything that's high in trans fat, because all of that's going to be detrimental not only on the heart but the arteries as well. Okay? All right, I am going to stop here for the day. Does anybody, let me get my list of participants. Okay. And does anybody have any questions?
No.
No?